Welcome to the Rio Rancho Public Schools training on Diastat administration. This training was developed by the Health Services Department to prepare the school employee for administering Diastat in an emergency situation in the absence of the school nurse. I would like to thank all the wonderful nurses in our district that contributed to the development of this training program. Diastat is a medication that's given in an emergency situation that will stop continuous seizure activity. A person experiencing a seizure does not breathe during the seizure. If the seizure lasts longer than 2 to 3 minutes, it becomes an emergency situation because the person is not receiving oxygen to the brain. Brain damage and death can occur as a result of this continuous seizure activity. At the end of this program, you will be able to recognize the symptoms of status epilepticus. Recognizing the signs of status epilepticus is the first step in administering Diastat. Safely identify the correct student and medication prescribed by the physician. Administer the medication according to the student's health management plan and the manufacturer's recommendations. The staff member should be able to read and understand the student's health management plan and follow the directions outlined in the student's plan and administer the medication properly. Also note, this training lists specific procedures. You might want to grab a pen and paper to write these down as they are presented. Remember, you can pause the training at any time to take notes. Seizures can be harmful because when a seizure begins, the student will lose consciousness. The student can sustain an injury from a fall during a seizure. Also, the student can be deprived of oxygen during sustained seizures as they are not breathing during epileptic episodes. A lack of oxygen to the brain will cause brain damage. There are several different reasons why a seizure might occur. One is abnormal electrical discharges in the brain. Some may be a result of a medical problem such as low blood sugar, head injury, accidental poisoning, high fever, or drug overdose. The cause of some seizures may not ever be known. There are no contraindications to using Diastat in the event of an emergency such as status epilepticus seizure. Side effects include sleepiness, dizziness, and fatigue. The medication should be stored at room temperature. Do not freeze, refrigerate, expose to light, or heat. Check the following before using Diastat medication. The medication should not be given after the expiration date on the pharmacy package. Inspect the Diastat syringe for cracks without completely removing the cap. If cracks are noted, the medication could have leaked out of the syringe. Call 911 immediately. If there are no cracks present, then administer the Diastat according to the physician's instructions, package insert, and this training. All medication should be checked 3 times before given to make sure you have the right student, the right medication, the right dose, the right route, and the right time. Identify the student with the seizure activity by matching the photo on the student's health management plan to the student. Identify yourself to the student and let him or her know you will be helping them in the event of a Diastat emergency. Valium is the medication contained in the Diastat Acudile rectal syringe. Diastat comes in prepackaged, pre-filled, and pre-measured doses for children ages 2 and over and for adults. The physician has prescribed the correct dosage for the child. Diastat is always administered rectally. The time to give Diastat is based on the student's symptoms and instructions from the student's physician in the health management plan. Let's review the signs of a seizure. You may want to grab a pen and write these down so you can review them, and hit the pause button if you need more time. Here are the signs of a seizure. Brief staring spells, 5 to 10 seconds. Periods of confusion. Head dropping. Sudden loss of muscle tone. Episodes of rapid blinking or eyes rolling upward. Inappropriate movements of the mouth or face accompanied by a blank expression. Aimless, dazed behavior, including walking or repetitive movements that seem inappropriate to the environment. Involuntary jerking of an arm or leg. Not all these signs occur every time or with every seizure. Signs of a seizure emergency are a prolonged seizure lasting longer than 10 minutes, a series of repeated seizures without the return of consciousness between seizures, and the child's lips or coloring turns blue or gray. So let's say you're seeing a child having a seizure. What do? Write down these steps. Stay calm. Note time seizure began. Ease student to the floor. Loosen any neckwear. Cushion the head. Do not restrain or hold the student down. Do not put anything in the student's mouth. Clear immediate area of any furniture or other objects that may cause injury. After the seizure subsides, roll the student onto their side. Monitor the student's respirations. If they turn blue or stop breathing, initiate CPR and call 911. If they begin to vomit, be sure to roll the student onto their side, but keep a close watch on their breathing. When the person regains consciousness, talk gently to them and stay with them. Be sure to contact the student's parents and/or physician as soon as possible, and be ready to share all relevant information. If you're unable to reach a parent or physician within a period of 15 minutes from the onset of the incident, call 911 for further medical support. So let's talk about the specific steps you must take to administer Diastat to a student. The student's physician will dictate how long to wait before administering the Diastat. It's really important to review this information in the student's health management plan so you know how long to wait. That's why it's critically important to note when the seizure began so you will know how much time has passed. If gloves are available, now's the time to put them on. First, put the person on the side where they can't fall. Provide the student with privacy by removing other students from the room or area. Now go get the medicine. Now get the syringe. Note that the seal pin is attached to the cap. If gloves are available, it would be helpful to put those on at this time. Step 4 is to push up with your thumb and to pull to remove the cap from the syringe. Be sure the seal pin is removed with the cap. Step 5 is to be sure to lubricate the rectal tip with lubricating jelly. Make sure the student remains safely on their side during administration of this medication. Step 7. Now bend their upper leg forward to expose the rectum. Next, separate the buttocks to expose the rectum. Now gently insert the syringe tip into the rectum. Please note, the rim should be snug against the rectal opening. You're going to count to 3 during each of the next steps. Slowly count to 3 while gently pushing the plunger until it stops. Slowly count to 3 before removing syringe from the rectum. And slowly count to 3 while holding the buttocks together to prevent leakage of the medicine. Finally, keep the student on their side facing you. Be sure to note the time the medicine was given and continue to observe.
It is imperative to notify the parent and/or physician immediately that Diastat has been administered to this student. If you're unable to reach the parent or physician, contact 911 immediately for further medical assistance.
When the student is secure, you'll need to be sure the Diastat plunger is disposed of correctly. First, pull the plunger until it's completely removed from the syringe body. Now point the tip over the sink or toilet and expel remainder of the medicine if any is left. Flush the toilet or rinse with sink water until gel is no longer visible. Discard all used materials in the garbage can. Do not reuse. Discard in a safe place away from children. Once you've administered the Diastat, be sure to take these steps. Keep the student on their side facing you. Continue to observe the student for anything that would indicate a problem. Notify the student's parent or guardian and doctor of the incident. If seizures begin again, if the student fails to wake up or becomes dusky, blue or gray in color, call 911. What if you're on a field trip? Notify the nurse at least 2 days in advance of the pending field trip and review the student's health management plan and get any questions answered. Let the student know that you will have his or her Diastat and will be available to the student throughout the field trip. Assign a buddy to the student for additional support. Have telephone access at all times while off school property. Okay, here's a practice scenario to review what you've learned. You're a teacher in charge of a class that you've just taken on a field trip to the public library. You have a child who's a known epileptic. You have received a copy of the student's health management plan and have talked with the nurse and understand the information given in the health management plan. The student's Diastat is brought along with you on the field trip. The student falls to the ground and begins uncontrollable jerking. You notice that the seizure is lasting longer than what's allowed by the physician in the health management plan and decide it's time to use the Diastat. In this case review scenario, here is what you should do. You might want to write this down. Stay calm. Note the time the seizure began. Ease the student to the floor. Loosen any neckwear. Cushion the student's head. Do not restrain or hold down the student. Do not put anything in the student's mouth. Clear the immediate area of any furniture or objects that may cause injury. Provide privacy for the student by removing other children from the area. Administer Diastat according to the student's health management plan and physician orders. After the seizure subsides, roll the student onto their side. If the student turns blue or stops breathing, be prepared to initiate CPR. If the student begins to vomit, immediately roll them onto their side. If the seizure does not subside or resumes after administration of the Diastat, call 911. If the student turns blue or dusky color, resume or initiate CPR and call 911. Okay, that's about it. Enjoy this slide for a second because the quiz is about to begin. The quiz will help you review important points about this training. Be sure not to exit the training in the middle of the quiz so it doesn't score you as incomplete.